Our strategic plan is the roadmap to our success, and it really entices us to be healthy together. We used to measure patient satisfaction. That was important. But we've discovered that patient experience is much broader. So we're making sure you're happy with what's going on. And at every level, sometimes it's just not the clinical care that's important. It could be spiritual care. It could be just the way a physician talks to you, and that could be so important. So the patient experience is what we measure, and patient family-centered care, again, it's really the thread that holds that experience together, because patients and their families are our partners, so they're involved in that experience. So, you know, we put a 9-year-old patient on a committee with 2 anesthetists, 2 surgeons, 2 OR nurses, and some administrators. And they were put together to design a better way.
Well, I became a PFA because I felt the need that the hospital in Thunder Bay needed change. And I thought my voice and my ideas could implement like a better environment and place for patients. I found it very scary when I was younger that I'm just being pulled away from my family in basically kind of like a stretcher in my bed, and they just bring me in to a place that I don't know. So I kind of thought, well, if there's something children enjoy, then it'll probably make the experience less difficult for them to deal with. I've done projects like I've got red wagons for younger kids. When they go to surgery, it'll be kind of like a better atmosphere.
One of the initiatives that we're most proud of when it comes to patient family-centered care is our OR tours, our pediatric OR tours. What was happening is you'd show up with your child the day of surgery, and you know, the magic double doors would open, and a set of scrubs would come through and grab your child out of your arms and disappear through those double doors. So what we've got is crying children, stressed out parents, and you know, these parents were telling us this. They were telling us they weren't happy with that process. So we decided that we needed to change that. We needed to make it better. And you know, when you want to know how you're doing, ask a child. They tell you the truth.